Ladies and gentlemen, dear friends, welcome to the webinar of the International Society of Gynecological Endocrinology. This webinar is dedicated to management of infertility with carnitine and micronutrients, and is supported by an educational grant of Alpha Sigma. It's my pleasure today to introduce you to two speakers. One is Professor Alessandro Genazzani, Genazzani is Professor of Gynecological Endocrinology at University of Modena, and is responsible of the unit of Gynecological and Reproductive Endocrinology. He's also President of the Italian Association of Gynecological Endocrinology. And Professor Gian Maria Busetto is Professor of Urology at University of Foggia. He's mostly dedicated to the infertility in males and to the urological problems of males. Then we will have in one side a gynecologist speaking about the management of infertility in women, and the other one will speak about the management of infertility in men. It's my pleasure now to introduce the speaker, Alessandro Genazzani, and then Gian Maria Busetto. And we will have the first presentation from Professor Genazzani and the second from Professor Busetto. And then later on, we will have the general discussion. I suggest you have in your screen the question and answer button. You have to write your question. I will read the question, and then we'll do the question on your side to our speakers. And then now, Alessandro, you have the microphone. Please go on with your presentation.
Thank you very much, Andrea, and pleased to see you, Gian Maria, from very far part of Italy, but hoping to see each other in presence next time. Today, the topic is to deal and to, evaluate the better performances in terms of fertility in women.
You have to share your screen.
Using integration. Yes, I am arriving. I have just to reach the... Okay, it should be coming soon.
Yes, we have no doubts. Okay, perfect.
Okay, should be here. Anyway, the topic is just how we can improve fertility, how we can improve the impairments in terms of dysmetabolism, especially in a case, in a classic case of gynecological endocrinology, that is in PCOS. The real problem is that PCOS is a rather complicated disease, which is occurring up to 20% of the population. And this depends on several issues that are mainly related to the ethnia or to the genetic predisposition. We know very well that the Rotterdam criteria have clearly defined that PCOS is present when at least 2 over the 3 issues are present. The excess of androgens in terms of clinical or biochemical evaluation, anovulation or abnormal menstrual cyclicity, and an ovarian morphology, which can be related to be with a shape of polycystic ovary. Well, we have absolutely to start saying that not all PCOS are coming just as a random occurrence. There are predispositions and conditions that might trigger the occurrence of PCOS that are due to the fetal programming or maybe of being born as UGR or small for gestational age, but also the familiar predisposition to special endocrine diseases such as diabetes. In any case, these can affect the evolution during adolescence and creating the condition for having a deposit in excess, so that to have overweight or obesity, and then abnormal menstrual cyclicity. And later, after the fertility area of life, when going through the 40 up to the 50, we might have the triggering also to other diseases rather important, such as diabetes or cardiovascular diseases. So the thing that we have to face is that the 3 issues of the Rotterdam criteria might be combined one with the other, so that of having 4 distinct phenotypes. And the more severe phenotypes are those where hyperandrogenic condition is present. Classically, through the studies from Frank and Berga, we have in any case to consider that the occurrence of PCOS is a, how do you say, a unpolite and unfortunate combination of genetic factors and epigenetic factors. And altogether, these kind of actions are able to impair as a sort of model of combinatorial endocrinological disease. It might trigger the occurrence of PCOS. But the things that we have to remember is that is not only the presence of such as hyperandrogenic conditions, ovulatory disturbances, and abnormal ovulatory capacity that is occurring in PCOS, but also a higher risk of getting other diseases, especially during pregnancy. This is rather important since gestational diabetes, hypertension, and premature delivery are quite frequent occurrences during a PCOS that becomes pregnant. So the things that we have today to disclose a little bit and to understand is how to manage the adverse situations that PCOS might have due to the occurrence of specific conditions such as insulin resistance, hyperinsulinemia, which is a compensatory conditions, and other diseases affecting the liver functions that is affected by hepatic steatosis, and other conditions such as dyslipidemia. We have the higher risk in PCOS patients of having, obviously, diabetes. But insulin resistance is a classic disease in anovulatory patients, in hyperandrogenic patients. No, not at all. The fact is that insulin resistance is classically and unique in PCOS. It is not found in hyperandrogenic women due to other conditions, let's say hyperprolactinemia or adrenal dysfunction. Is classically occurring just in PCOS, but not only in overweight, obese PCOS. Up to 75% of them might have hyperinsulinemia, but also normal weight PCOS patients. This clearly gives us the idea that such high level of insulin are probably due to some other built-in mechanism that might trigger such kind of conditions of hyperinsulinism. Well, just giving a graphical idea of this, you see here that up to 60, up to 70% of patients with obesity might have hyperinsulinemia, but mainly not obese patients might have up to in 40% of the cases the presence of a compensatory hyperinsulinism. And insulin is a rather important hormone. It's a proteic hormone that is able to act and to modulate not only reproduction at the central level in the sense that it might trigger and stimulate GnRH release, but it also acts on the granulosa cells, promoting the production of androgens. And you know very well that androgens are the starting point through the aromatase conversion for the production of estradiol, but higher level of androgens due to hyperinsulinemia might induce a lot of trouble, and mainly the atresia of the follicles inside the ovary. But is insulin resistance a sort of classic disease? Well, the answer is no. The presence of insulin resistance is something which is physiologically established, especially in 3 moments of the female life. During pubertal maturation, and this occurs also in young males, we have the growing on of the skeleton, of the muscles, of the organs, and this is due to a physiological occurrence of insulin resistance that improve the activity of insulin and the level of insulin so that to have the body to grow. But this is occurring also during pregnancy. We know very well that the higher acquisition of the body weight of the fetus is during the 3rd trimester. And during this part of the pregnancy, we have the higher level of insulin circulating in the blood of the mother and also in part in the fetus. But also during menopause. Menopause is a rather peculiar situation where these ladies having an age above the 50s, well, they are characterized by the fact of having a reduced mobility and classically less ability to move in the environmental situations. And so the biology from the very far times, from the Paleolithical times, have decided to have insulin resistance to improve the amount of fat in this subject, so that to give them a certain amount of energy just to go on living without going looking for food. So the very starting point of this is that we need in all PCOS, as stated by most of the most important society all over the world, establish if these PCOS patients have a hyperinsulinemia. And we can perform this checking just doing an oral glucose tolerance test, performing the test not only for glycemia, but mainly for insulin plasma levels. And it is well known, and this is the important issue that we have to underline here, that the insulin sensitivity is going down and is reducing with a growing on of the body mass index. And this is correlated in a very rather important manner with the increase of the systolic blood pressure. This means that the higher is the body mass index, the lower is the insulin sensitivity, the higher then is insulin resistance, the higher is the cardiovascular risk. And this is rather important since as a central point of the metabolic syndrome, which is a very unfortunate, widespread all over the world disease, the metabolic syndrome has in the center the increased insulin resistance, which is the trigger for the pro-inflammatory and pro-thrombotic state, as well as for the altered lipid profile and the risk of hypertension. So when we talk about PCOS, we have to remember this kind of listing. If you check it, you see that there are most of the many triggers of the risk of the cardiovascular diseases, as well as of a lot of other diseases due to the lipid profile control. So this means that PCOS have incredible risks of getting a lot of diseases, but insulin is a rather important hormone, not only for driving the activity on the metabolic aspects, but mainly if it is too much circulating in the blood, in modulating in an abnormal way, whatever is the control, the neuroendocrine control of reproduction. So this means that on one side, we have the impairment in the metabolic control of our biology, and on the other one, we have an impairment in the control of reproduction. So according to this, PCOS is a sort of black hole. It's something which is absolutely complicated. There are absolutely a lot of items that we have to consider, and up to now, and this is true, we have to say this, there is no standard cure. We have not yet established a specific track to follow just to cure PCOS. Well, we have some first-line treatments, and this depends mainly on what kind of symptoms the patient is occurring. But obviously, you can see here, we have a lot of strategies that might occur and might be applied just to resolve the problem of acne, of the menstrual cyclicity, or maybe the metabolism impairment, such as the changes in the lifestyle, obviously, and the use of metformin. But if we have to consider the ability of PCOS to get a pregnancy, well, obviously, we need to have something that is able to improve or to create a better ability to have ovulations and then the chance of getting the fertilization of the oocytes. Well, such kind of treatments have been clearly organized according to the fact of having or not having contraception. So this is just a resumption of all what I have said up to now, and you can understand that whenever you have oral contraceptive pill or whatever is anti-androgenic combined with oral contraception, obviously there is no chance of fertility. So avoiding such kind of treatment, what can we do just to improve fertility in these PCOS patients? Well, there are several strategies that might be suggested and that might be actively operated in these PCOS. So let's start saying the first thing at all, absolutely the most important, lifestyle. This is an old paper from 2011 from the group of Moran, and they clearly demonstrated, this is a beautiful meta-analysis, that if you pay attention to the food, you reduce carbohydrates and glucose eating well. This reduces the body weight, improves insulin sensitivity, and obviously reduced the insulin plasma levels. And the waist to hip ratio, an important classic measure that you can take in your patients, is going down, so that to demonstrate that you are improving the control of body weight and of the amount of fat in the abdominal part. But are there, above the fact of having a little bit of exercise and a control of diet, specific strategies for these patients to improve the metabolic impairments? Yes. First of all, the most important and commonly used insulin sensitizers, that is metformin. This is a perfect treatment. It's quite old. It is a 64 years old treatment, but it's perfect up to the fact that you have to use low doses every day, since it might create some problems. Anyway, it is clearly, this is a 12 years old paper from our group, demonstrated that metformin gives the better results whenever you have a real hyperinsulinemia in these patients. High level of insulin in baseline conditions and high insulin response to the oral glucose tolerance test. And the real problem for these patients is the body weight. The problem is the body weight, since whenever you have a high body weight, you have to improve the dosages of metformin up to 3 grams every day. And above 1 or 1.5 grams every day, you might have a lot of side effects, such as nausea, vomiting, and gastrointestinal disease. And this reduces, obviously, the compliance of the patient. So, is there any kind of other solution? Well, there are solutions, integrative solutions that probably might be suggested and might be used for these patients, especially for those that would like not to go through the treatment with metformin, or would like to expect getting regular menstrual cycles through the use of integrative compounds, such as some of the ones that I have listed here: carnitines, cysteine, arginine, or inositol. Well, all such kind of integrations have been demonstrated to be able to affect positively the insulin sensitivity, to induce a higher improvement of insulin sensitivity whenever we have a PCOS, but using each of them at very high daily dosages. So the real problem is probably that we might expect to use them in a more clever way, that is combining them. But first of all, carnitine is probably one of the most important issues that have been demonstrated in the last 30 years to be able to reduce insulin sensitivity, improving beta oxidation of glucose, so improving production of energy and mainly reducing the availability of glucose all over the body weight. Such kind of activity is played at the level of the Krebs cycle, improving the utilization of the beta oxidation so that to eliminate the glucose inside the cells, mainly at the level of the central nervous systems, as well as you can see here in this table of several papers, at the muscle level. But another interesting and important element to control insulin sensitivity is cysteine. Cysteine is able to remodulate and to reactivate glutathione, which is the most important antioxidant compound inside of our biology. And such kind of activation is absolutely necessary just to block and to eliminate the so-called ROS compounds produced by excessive oxidations inside our body at all levels. Cysteine, as well as N-acetylcysteine, are able to counteract such production of ROS, and mainly affecting through a complicated pathways is able to block or to reduce the pro-inflammation, which is a trigger of insulin resistance. And arginine. Arginine is another important compound. It's important in our biology, and is interesting to observe that the level of arginine in patients with PCOS is absolutely reduced. And arginine is important since it is involved in the production of nitric oxide, one of the most important substances which is able to induce the vasodilatation at the endothelial level. But on the other side is also nitric oxide involved in the activation of and the reorganization of the glutathione pathways so that to block ROS. This is rather important since it has been demonstrated that in PCOS we have a reduction of the production of nitric oxide for the lack of specific enzymes which are not really expressed adequately in these patients. So we have a sort of built-in problem that have been demonstrated, and you can see here from this very nice paper from Carvalho, that the addition of arginine is able to induce a higher express of the insulin-induced AKT phosphorylation. And AKT is a rather important molecule which is able to activate the GLUT4 vesicles, which are responsible for the upload of glucose in all over the cells of our biology. And that's why we have decided to try to combine carnitine with cysteine and arginine. And we made a very nice experimental design using a very easy integration, a SEC that is administered every day in this group of patients, 45 patients with obesity that have been characterized with the Rotterdam criteria, and all of them were treated for up to 6 months. And you can see here that the whole set of patients demonstrated an incredible reduction of the insulin in baseline conditions with a nice improvement of the total cholesterol and HDL profiles, with a relative reduction of the body mass index, since these patients were instructed not to change the lifestyle. When we checked these patients, we observed that there were two groups of patients, those having high level of insulin in baseline conditions, and there were 39 of them, and just 6 up to 45 did not show such kind of hyperinsulinemia in baseline conditions. Well, the highest amount of these patients treated with this combination demonstrated the best results in terms of the improvement of the dysmetabolic conditions, with a very nice changes also of the OMA index. And this is a rather important effect, since we know very well that OMA index is the demonstration when it is abnormal of the abnormal insulin resistance present in these patients. Well, facing the fact that all these patients were undergoing the oral glucose tolerance test, well, we have here depicted the profiles of the insulin response. On the left, you see all the patients all together. You see in baseline conditions how high is the insulin response. And look here, how is incredible the reduction of the insulin response after just 3 months, and a higher reduction is also occurring after the 6 months of treatment. But when we subdivide the group of the patients in those with hyperinsulinemia in baseline conditions with a normal insulinemic patients, you see that the changes are very impressive in the patients who really show hyperinsulinemia, not only in baseline conditions, but mainly under the oral glucose tolerance test, while changes, minimal but important, are occurring in the small number of the patients with normal insulinemia. But why is such kind of combination of nutrients able to affect in a positive way the metabolic pathways? Well, In PCOS, we know very well that the oxidative stress is impairing the ability of arginine through an abnormal enzymatic situations to produce nitric oxide, and the reduction of the nitric oxide impairs the nitrosocysteine and nitrosoglutathione production. This is also due to the fact that there are a reduced amount of thiols radicals available for such production. All these impairs the GTP to cyclic GMP passages, and this alters and modifies the ability of calcium to enter inside the cells. But when we give arginine and when we give cysteine or N-acetylcysteine, we have the reestablishment of such kind of ability to produce inside the cells nitric oxide, and we restore the ability to reactivate the production of nitrosocysteine, which is a restabilization of the impairment in the control of the calcium channels. This is rather important since such kind of passages from GTP to GMP is absolutely relevant not only for the endothelial cardiovascular aspect, but also for the oocyte development, since these kind of channels and of functions are occurring inside also the follicles, inside the ovary. So this is rather important, something that is rather important to be resolved, and the impairment needs to be eliminated. So going through a sort of comprehensive summary of these, we can say that the integrative and the combinatory approach with carnitine, arginine, and also cysteine improves on one side the effects through carnitine of the reduction of the hyperglycemia, and on the other side, the reduction of the oxidative stress, so that we have a reduction of pressure and also triggering to have insulin resistance, and on the other side, a pro-inflammatory state. This is rather important. It's rather important also to have a new evolution of such combination, since why not to consider the addition of inositol? And in fact, inositol might be and has been added to such a combination of carnitines, arginine, and cysteine in the amount of 1 gram every day. Such kind of addition is rather important, since we know very well that inositols are element essential in the functions inside our biology. And myoinositol is a small molecule very close to the structure of glucose, is a sort of post-receptor signaling for a lot of hormones. Inositol is normally produced in our biology from glucose 6-phosphate, but mainly is coming from the food, is coming from beans, from vegetables, from the meat, and is the passages through the two important, most important shapes of inositols, which is myo and dikiro. The balancing of these is the one in charge of maintaining the ability to control not only the signal of insulin as a post-receptor signaling, but also of TSH and FSH. So look, TSH is the other important hormone for the control of the metabolic structure of the endocrine control of metabolism, but FSH is the first and most important gonadotropin that stimulates the evolution of the follicle. So myoinositol is the rather important element, so that to have the better response of the granulosa cells and oocyte towards the evolution to ovulation. But also myoinositol is able to act on a lot of other activities inside the brain and inside the muscles. Myo and dikiro are in balance in specific elements of balancing, controlling not only the metabolism in the tissues, but also the activity, mainly the myo effect on the FSH signaling, similarly to the fact that myo is able to induce a better performance of insulin and TSH, so that to have the better performances, obviously, of our biology. Well, we tested myoinositol having good results not only in patients who were obese with a reduction of the level of LH, but mainly the reduction of a level of insulin. And we observed that this was occurring also in the so-called group of normal weight PCOS, where again LH was reduced, but though of normal body weight, in baseline conditions, at least in this study, the level of insulin were normal, but mainly through the effects of myo-inositol, we were able to better control the reproductive hormones. And these, in this group of patients, reduced the level of androgens. But many other issues have been done, and the use of myo-inositol as a supplemental treatment was able to improve the ability to conceive in patients with PCOS going through the reproductive programs. So this means that probably we have now the better chance to get the better performance of the integration, choosing the combination of them, having carnitines in acetyl and L-carnitin added together with the cysteine and to L-arginine with the addition of myo-inositol. The first group are working on the metabolic issues, while myo-inositol is improving the management of the reproduction through the post-receptor signaling. The problem is that PCOS, as you can see from this cartoon, is a rather complicated syndrome. You see, complicated since it clearly drives the lady towards the failure of the good health with the cardiovascular risk, hypertension, anovulation, dysmetabolism, the risk of diabetes. So the best chance is to take the advantage of the integrations to try to avoid such evolution. You see here, PCOS is the starting point, might be induced by obesity. There might be epigenetic factors, might be also, induce a certain degree of stress. And this kind of stress is just a triggers of other conditions, of these metabolic conditions and alterations of endocrine control of a lot of functions, predisposing to dyslipidemia, diabetes, hypertension, and cardiovascular disease, and mainly driving also at a certain conditions to cancer risk due to the imbalancing of the hyperestrogenic conditions that PCOS might have. So I think that we have to look at PCOS with a completely different view, trying to improve the ability to re-establish the equilibrium of the normal nutrients that are needed with a lifestyle just to get a better performance in health and in the chance of to have a baby. Thank you very much.
Thank you very much, Alessandro. It's a fantastic new approach and vision toward polycystic ovary syndrome, where at the same time micronutrients clearly show their important impact in the management not only of insulin sensitivity and resistance, but also in the management of many other factors who are part of that syndrome. And now, before to go to the discussion, we have already a nice series of questions coming. I would like to invite Gian Maria Busetto to speak about micronutrients impact in male infertility. Please, Gian Maria, you have the microphone.
Thank you, Professor, for the presentation. I will go ahead with my presentation.
Please.
And it's a pleasure to share with all of you my data, my experience. And let's share the screen.
Yes.
Do you see my slides?
Yes, perfect.
Good. So I love always to start with the slide that is this one. And I would like to show you how is changed the feeling regarding the male infertility between the past and between the present. So if you look at here, it's written that this was an article of the New York Times in 1982, and this reported how the infertility was something most men never had to face, because almost potency and fertility were considered synonymous. And in many societies, if a marriage was barren, the solution was to get a new wife. So if you look at this vision that was not so many years ago, something like 40 years ago, while you think that today that doctors agree that men are responsible nearly for 50% of the male infertility. And this other article that has 4 years and that is reported that the infertility crisis is beyond doubt. Now scientists must find the cause. There is a study from the University of Hebrew in Jerusalem that is reporting that we have an average 1.4% of decrease of our fertility per year. So this is really such problem. It is really something that we have to take care. And during these 40 years, we try to understand as much as we can regarding male infertility, and we even try to introduce a new concept that this paper of 2015 is reporting, that infertility, male infertility, can be even considered as a proxy of our general health. So is it true that when you have a decreased fertility, even your health is not so good? So there are many papers and many reports at this regard. For example, this paper that analyzed more than 2,000 patients and made a comparison between the Charlson Comorbidity Index, which is a system to evaluate our comorbidities, and the fertility, and reported that all the parameters of the sperm, including the concentration, including the count, and even the hormones, are reported to be altered in patients having such kind of comorbidities. Even this gentleman, this professor, Professor Salonia from Milan, in 2019, in our latest Congress of the European Association of Urology in Presence that was held in Barcelona, reported a mechanism to try to explain how this male fertility can be connected with our fertility. And it's a complex system, including all the axes from the hypothalamus to the testes to the adipose tissue. So all these changes report even changes in our fertility. But what we know about male fertility causes, because this is really the big problem. So how many causes of male infertility do we know? So we know for sure that something like 30% are idiopathic. So this means that something like 30% and probably even more, we don't know the real cause. Then we know that between known causes, the varicocele for sure is the most represented. So we have something like 15% of male suffering from varicocele that have male infertility. And what about the diagnosis? Which is the diagnosis process with these patients? So what we do is usually a semen analysis that it seems to be a simple exam, but is really important in the routine diagnosis. But unfortunately, it fails to detect any abnormalities. So it's really important to do a correct semen analysis with all the latest quality control and quality assurance. But semen analysis is only able to make a diagnosis, not to detect the reason of this semen alteration. And the 5th version of the WHO is the actual one, but is coming out the 6th version that will be updated. And it is important to refer to these values. The endocrine part that has been reported for the female from the Professor Genazzani really well, it's really important even for the man, because when you have an alteration in testosterone, in LH or FSH, in the inhibin B, in the prolactin, all these hormones are reported to be connected with male infertility, as well as genetic testing. That is another common reason of male fertility, because when you have an alteration of cystic fibrosis gene, the Y chromosome microdeletion, abnormalities in chromosome, and all of this genetic alteration can be the cause of a severe oligospermia or even to azoospermia. But when you have excluded to have a genetic cause, when you have excluded to have a varicocele, or when you have excluded a endocrine situation, unfortunately you have you don't know which is the real cause of this infertility. And this is why in the latest years several different tests to evaluate better the sperm came out, And mainly they are made by the assessment of the active oxygen species, really important. The assessment of the DNA fragmentation, because DNA fragmentation as well can be reported in infertility. Test that reports the function of the sperm, so acrosome reaction, hemizomia, and other like this, together with biochemical tests. So all of these tests connect us to another concept, because what I want to introduce now is a new concept that has been delivered in the last 2 years. And I am one of the members of this new concept that has been released 2019. And we published this concept that is the male oxidative stress infertility. The nickname is MOSI because it's the male fertility that is related to oxidative stress, to reactive oxygen species increase. So once again, as you can see, when you have genetic, hormonal, varicocele, systematic disease, lifestyle, almost in 50% of these cases, you can give a reason to male infertility. But unfortunately, something like 50% and another series, something like 30%, you are in front of idiopathic infertility, and you are not able to explain why it's common, this infertility. And this is why we introduced the new concept of MOSI. And to make a summary of what MOSI is, when you have an idiopathic male infertility in which a man has an altered semen characteristic without an identifiable cause, and if there is not a female factor, this is a challenging condition and it's difficult to explain why. The oxidative stress can affect negatively this fertility, including interference with capacitation and damage to sperm membrane and DNA, which may impair the sperm potential to fertilize an egg. Male oxidative stress as a novel descriptor for infertile men with abnormal semen characteristic and oxidative stress. Oxidative reduction potential can be a useful clinical biomarker for the classification of MOSIs. So we try to give an explanation of why in this 50% of idiopathic infertility, the fertility is not perfectly functioning. And probably the oxidative stress and the alteration between oxidation and reduction can be the cause of this infertility. And this oxidative stress male infertility can be even measured. And to measure the oxidative reduction potential can be a biomarker, so that can help us in making a real measure of this oxidative stress. As you can see here, there is a big difference between oxidative reduction potential between abnormal semen and normal semen. And in the last report, we even found that 1.34 is the cutoff to divide between who has the normal oxidative reduction and oxidative reduction potential, and between those that have increased oxidative reduction potential. And in fact, this can help us even in guiding the therapy, because when you have a male infertility and you measure the oxidative stress, when you have something that is even connected with the inflammation, you even give the therapy together with the antioxidants of antibiotics and anti-inflammatory. When you have a problem with your lifestyle, you can counsel the patient to change his lifestyle. When you have a varicocele, you can counsel the patient and you can suggest him to make a varicocelectomy surgery. But when you don't find varicocele, inflammation, lifestyle, or other causes that you can take care of, you will give antioxidant supplementation and then retest the oxidative reduction potential to see the effect of this antioxidant supplementation. This is why one of the easiest ways to measure the oxidation reduction potential is the MyOxis. It is a machine that has been released something like 3 or 4 years ago. And it's really easy because it's really effective, is not time consuming, is portable, is cheap, and it's something that can help you so much in making this evaluation. Substantially is calculating the statistic oxidation reduction potential and the capacitance reverse. all of these data are normalized with the sperm concentration, and then you will have a number that will indicate to you if the oxidation is too much. And as I told you, the last cutoff that is used is 1.34. But if you look at the beginning of the experience with this machine, the results was really good, because this is probably the first paper that has been delivered with the Myoxis. And in this paper is you can see as how there is such a big difference between higher ORP or lower ORP. In this case, the 1.48 was the cutoff. But now we have continued our research, and now we are using 1.34 as the cutoff. This is another experience, more recent, with up to 600 patients. And here is reported really a big difference between higher and lower ORP in comparison with male fertility and sperm parameters, with an area under the curve of 0.7. So it's something that is statistically significant and something that can be helpful for us. At this regard, I would like to explain to you the concept of oxidative stress and why the oxidative stress is important to understand better the male infertility, and to better understand that is important to take care of the oxidation and reduction, and even to do some therapies in this situation. Oxidative stress can cause damages to the sperm at every level, can act on the head, on the midsection, and on the tail of the spermatozoa, because it can make damages on the DNA part of the spermatozoa, can act on the natural defenses, but even on the sperm tail that are important for the movement. You have to take in consideration like that the oxidative stress and reactive oxygen species are like some pinballs that bounce over the sperm, creating damages every time that they bounce over the spermatozoa. In fact, when you have a slight increase of ROS, you will start having membrane damage that will go through membrane instability, functional alteration, and if it's really high, the reactive oxygen species, you will have cell death. This is why it's important to distinguish between high concentration and moderate concentration of reactive oxygen species, because it will be completely different the action on the sperm, because you will have high mobilization till the cell death. So for this reason, having a correct measure of reactive oxygen species is really important at this regard. But even regarding the mitochondria and the energy metabolism, because the reactive oxygen species that goes inside the mitochondria can have a bad action on the energy metabolism. And as you can imagine, it's really important to have the correct metabolism of the energy in spermatozoa that have to go through the egg. And at this regard, we can keep in mind that there are even some medical treatment that can keep the balance between this oxidation and reduction, and the antioxidants might help in keeping this balance between production and clearance, because you have to keep in mind that you don't have to reduce as much as you can the oxidation, because a part of oxidation is useful for the capacitation and the acrosomal reaction. So if you lower too much the oxidation, you will have once again a bad action. So you have to keep, as with the scale, the correct balance between oxidation and reduction. In this regard, the carnitines has been extensively studied as antioxidants to keep this correct balance, and they are really important because L-carnitine can help bringing energy inside the cells, but even removing toxins from the cells. So as a double effect on the metabolism of the cell of the spermatozoa. And some literature to explain you why it's important to know the carnitines effect has been reported starting from 2005 with this important paper came out on fertility and sterility, where 60 patients have been enrolled and have been treated in 3 different groups with placebo, with acetyl L-carnitine, or with the association between L-carnitine and acetyl L-carnitine. And as you can see, all the parameters of the sperm, motility, the velocity, progressive velocity, all of these parameters increased statistically significant differently between those that were taking placebo and those that are taking the carnitines. This graph helps you understand the results. The association between L-carnitine and acetyl L-carnitine is the best to obtain the results in the motility and in capacity of the sperm to be better in terms of fertility. Even the pregnancy rate, even if it was a secondary endpoints, reports that 9 pregnancies out of 12 occurred in patients taking the active treatment. Only 2 pregnancies resulted in the other groups, and so even in these parameters, the pregnancy rate, there is a statistically significant difference. There is even a meta-analysis that is analyzing several papers in this regard, and all of these parameters analyzed and report how everything is in favor of the treatment, even the pregnancy rate once again. So carnitines helps increasing your fertility. And here, sorry, this is the pregnancy rate, is statistically significant. But by the end, what is the truth and what we have to consider regarding antioxidants? Because by the end, antioxidants should be considered as empirical medical treatment, because guidelines still doesn't report that there is a strong evidence in suggesting antioxidants. Even hormonal therapy, there is not a strong evidence to make a suggestion at this regard. But by the end, analyzing all the literature in the latest years, all the systemic reviews and meta-analysis suggest that oral antioxidants are able to increase in a significant way live birth rate compared with control treatments. So it seems to be effective, the treatment with antioxidant, even if the guidelines, as I told you, still they cannot make clear recommendation at this regard. This is exactly why we should go ahead with our study, with our trials, with our double-blind placebo-controlled trials, in order to continue analyzing data, in order to arrive to a final suggestion regarding the antioxidant therapies. And this is why I would like to present you in the last part of my presentation our experience, because we are from several years that we are making experiences at this regard. And I would like to start with this paper that has been published in 2018 from me and with my group when I was in the University of Rome. And we try to understand better the capacity of antioxidant to increase male fertility. And at this regard, we made a study, a double-blind placebo-controlled study, a really rigorous study, because we really wanted to have real results. And for this reason, we used this trial to see if the sperm quality in subjects with oligo or astenoteratospermia and with or without varicocele can be effective in the treatment. Patients have been treated with antioxidant for 6 months, and a spermogram was made before the beginning of the treatment and after the treatment. This is the study, 104 patients, 52 with varicocele and 52 without. And then both of this group have been divided between those uptaking the placebo and those uptaking the supplementation. And the results are quite interesting, because you can see on all the main parameters, the progressive motility, total motility, concentration, and sperm count, all of these parameters are in favor of the treatment in comparison with placebo. And in patients affected by varicocele are even more evident these results. And this is for this reason that with varicocele, all the parameters are almost, you see, almost all the parameters are statistically significant, but even on those without varicocele are statistically significant. But once again, the pregnancy rate that was observed as a secondary endpoint reported 12 pregnancies, of that 10 occurred in proxy-treated patients, while only 2 in the placebo group, and 1 was having an abortion. in order to explain you the importance of this study, of this trial, in 2021 came out this paper from the Men's Health Journal that is a report of highly cited articles in the field of male infertility and antioxidants. And our study is reported to be the 17th worldwide most cited paper. So this, once again, to confirm that our data are real, the study is well conducted, because there is a highly citation rate. And for this reason, this is the number 17 between the most highly cited papers worldwide. And even the compound that we used as came out to be the most prescribed worldwide, because this global survey that me, together with all the other colleagues, conducted worldwide, we saw that Proxid is the most prescribed antioxidant worldwide. And even the elements included in the Proxid Plus are the most prescribed, because the zinc is the most. The second is a vitamin E. And then there is the carnitine. So you can see that between the most important antioxidant worldwide, carnitine is the third one and is the most important element of the antioxidant that we're talking about. And all of these parameters are reported because of scientific evidence and personal experience. So this is something that doctors are reporting after having experience with the patients and after gathering scientific evidence. So these data are important and are confirmed by evidence-based medicine. So once again, the importance of our trial. This is why with the same database, we continued and we analyzed better our data. And in the second paper, we analyzed on the importance of the body mass index and aging, how these two parameters can correlate with the antioxidant supplementation. And what came out is that a significant difference in supplementation efficacy was observed for total motility in patients with varicocele. And in the same group, also the progressive motility was significantly superior. And for the responders analysis, total motility results were confirmed in both the side group. So substantially, this second trial, the second analysis, report that supplementation is more effective in subjects with varicocele younger than 35 and with the body mass index inferior to 25. So once again, the importance even of the lifestyle and how the antioxidant can help in changing our lifestyle and our life habits. Because when you are younger and when you are not obese, the effect is better of the antioxidants. This is the graphs reporting what I told you. And it is, by the end, our new experience, because since the good results that we obtained with these two previous studies, we decided to go ahead with our research, and we decided not to stop only in looking at the sperm parameters. In this new trial that we are that is underway, we decided to look farther than the spermogram and the sperm parameters. We decided to look at the DNA fragmentation and to the oxidative stress measured by the myopsis. So this study, that is a placebo-controlled double-blind, once again, is on oligo and or asteno and or pterodospermia and with varicocele. So we decided to stay only in patients with varicocele and with OAT, and we measure on these patients the spermogram, the oxidative reduction potential with myopsis, and the DNA fragmentation. This is done at the beginning of the study and after 6 months of the therapy. And by the end, we would like to make a comparison between those taking the placebo and those taking the compounds. At the moment, we already have enrolled 26 patients. Today, we enrolled the 27th. So we hope by April 2021 to enroll 80 patients and conclude by April 2022 the enrollment, and to obtain after 6 months of evaluating latest patients the results by December 2022. So I hope to come soon to you with the result of this other interesting paper. This once again to confirm and to stress that, as for any drugs, clinical efficacy of any natural compounds must be demonstrated by double-blind placebo-controlled trials. And with this, I conclude my presentation, and I would like to thank all of you.
Thank you very much, Gian Maria Busetto. Your study was very clear, very suggestive for the importance of MOSI. And then now we have a huge series of questions that they already arrived. I will start, then we have the beginning. Mario Iliceto was asking, dear Professor Alessandro Genazzani, when you speak about carnitine, how many carnitine are you using? I guess free levocarnitine and acetyl carnitine, and then should be there. And then thank you in advance.
Okay, thank you. Yes, when we speak about carnitines, we have always to think about the combination of acetyl carnitine with L-carnitine. Both are able to enter inside the brain as well as to spread all over our biology. But the most relevant fact is that acetyl carnitine has a specific effects on the neuroendocrine pathways inside the neuroendocrine control of reproduction. We have already demonstrated in functional hypothalamic amenorrhea that 1 gram of acetyl carnitine was able to improve the production of gonadotropins inside the pituitary through the GnRH stimulation. Acetyl carnitine is cleaved. You leave the acyl radical, and carnitine is able to work on the Krebs cycle. And acyl radicals are able to modulate the opioidergic pathway, blocking the beta endorphin blockade on the function inside the hypothalamus. So it's a complicated story, the fact that the carnitines are able to modulate reproduction, but in this case, we need to have both the equilibrium. The Proxid women preparation have 500 milligrams of acetyl carnitine and 250 milligrams of L-carnitine, moving and acting on such pathways.
Thank you. And then Mario Iliceto have also a question for you. Dear Gian Maria Busetto, can also an highly reduced dendrocyte of oxidized semen sample be negative in relation to semen quality?
Exactly. This is really the point that I want to stress. Why is important to measure the oxidative reduction potential? Because when you have a too high oxidation, you have a damage over the sperm. But even when you have a higher reduction, you have a damage to the sperm. Because a higher reduction can avoid a correct capacitation and acrosomal reaction. So what is important is to keep the correct balance between the oxidation and reduction. This is why you should measure with the MIOXIS, the oxidative stress, in order to avoid to have too much reduction or too much oxidation. And for this reason, this can help you giving the correct amount of antioxidants. Because if you have a patient that is in favor of reduction and you give to him, for example, other antioxidants, it will make a damage because you will increase more and more the reduction and creating more and more damages. So it's important the correct balance. Exactly, this is the most important point.
Thank you very much. And then Nudrat Tazin can ask Alessandro Genazzani, can we use inositol for adolescent polycystic ovary?
Oh, absolutely, yes. Well, we have always to keep in mind that we are discussing about nutraceutical compounds, which are very natural compounds that usually are present in our food, in vegetables, in beans, in seeds, or in the meat. So the correct addition of these compounds in our not so, how to say, well organized food of everyday life is able to improve the quality of the reproductive axis and of the metabolic pathways, not only in adult humans, but also in younger humans, especially in adolescents, where we know very well we might have not a proper, how to say, attention to the feeding and to the normal use of carbohydrates, pizza, pasta, potatoes. You know very well that kids are kids, so we have to keep everything under control. But in case of overweight adolescents or obese adolescents, probably we might start to keep them under diet and probably to add a little bit of integration with inositol. Yeah, inositol.
Thank you. Sorry. You're finished? Okay, then for Gian Maria Busetto, consider that nearly 30% of causes of male infertility are unknown. How much do you believe that the MOSI can explain us idiopathic infertility?
Exactly, this is the point, because the MOSI has been introduced in our terminology and our dealing of the male fertility, exactly because we wanted to give an explanation of the 30 to 50% causes of unknown fertility. So we believe that between these idiopathic infertility, the oxidative stress can be a really important part of this. And for this reason, once again, measuring the oxidative stress, taking care with antioxidant can help keep the correct balance and maybe can decrease this amount of idiopathic infertility, and maybe can help even the couple that cannot give an answer to their infertility problems.
Thank you very much. And then for Alessandro, could this mix of nutraceutical compounds be administered in combination with oral contraceptive?
Absolutely, yes. It's rather important to consider that whatever is the treatment that the lady would like to have, and I'm talking about a fertile women, we might try to focus on one side on the dysmetabolism if we have overweight or just hyperinsulinemia. But on the other side, we have to keep under control the production of androgens and also of estrogens in these women. So we can keep on one side under control the reproductive axis also with contraception, and there is no obstacle to have a just addition of nutraceutical compounds driving these metabolic features. Since I have showed you, we are working together with carnitines and mainly with arginine and cysteine on all the pathways and tracks working on oxidation, pro-inflammation, and insulin resistance.
Thank you. And then for Gian Maria Busetto, a question: what do you believe are the most important limits in your study that you have published on varicocele and the treatment with micronutrients?
Exactly. This is the limitation of our study is exactly what connected us to the new trial that we are conducting. Because what we found in our paper that, as I told you, once again, is the 17th most cited worldwide. We found that the most important limitation is that we didn't evaluate the DNA fragmentation and we didn't evaluate the oxidative stress. And exactly for this reason, we decided to conduct a new trial focusing only on varicocele patients, where farther than the spermogram, we decided to evaluate DNA fragmentation with the tunnel test and to evaluate the oxidative stress using the MyOxys machine.
Thank you. Thank you. And then for Alessandro, I combined two questions, one for Aquila Hassan, and asking how can carnitine, cysteine, arginine can be administered, and another one for how long the integrative approach could be done, 3 months, 6 months, a longer time interval.
Yeah, that's a really intriguing question. The fact that we might have cysteine, carnitine, and arginine all together is just an oral addition. So we can just have these in a small sack every day. And we can keep such kind of integrative approach for very long periods of time. We have done a study for 6 months in a row, everyday treatment, everyday integration. But the experience that we made in these last 2 years clearly demonstrated that after first relative long time, 2-4 months of integrative treatment every day, if we got the result of keeping the metabolic pathways under control and improving the reproductive axis function, we might reduce the integration just to 1 every 2 days. So we might have 3 times every week the sack of Proxid women, just to maintain the efficiency. And this is rather important, especially those women that have familial diabetes or maybe that they have a predisposition to abnormal function on the metabolic pathways. So we can reduce the amount of the integration, but we suggest to maintain it as long as we could, just to keep everything under control together with a good lifestyle.
Fantastic. And for Gian Maria Busetto, another question. What do you believe it should be the correct way to check and monitoring of the treatment with this integrator for the male infertility?
Exactly. This is a new concept because in the past, when you was having a male with an idiopathic infertility, he was giving to him compounds, antioxidants, and that's it, without any dosage, without any check of the effect of this. The only way that we were using to check the results was to making a spermogram before treatment and after the treatment. Nowadays, we understood that it's not enough to make just a semen evaluation, but it's important, once again, to keep the correct balance between reduction and oxidation. And further than the semen analysis that is important, we are even to go ahead regularly with the meiosis evaluation. Because when you find that the reduction is too much, you have to discontinue the antioxidants. Maybe you can continue later, okay? So further than the semen analysis, you have even to take in consideration the capability of oxidative stress measurement.
Thank you. And then a question for Alessandro. You have also shown a slide from Paolo Artini working in that. What about the use of this combination before and during IVF programs?
Well, this is another important aspect that whenever a woman is looking for pregnancy, and we might face several problems, tubal factors or maybe semen factors that obliges these women to go through assisted reproductive technologies. Well, the problem is that probably if these patients are PCOS or just obese or just with a dysmetabolic situation, we might and we should try to improve these aspects before a couple of months or 3 months before they go under the assisted reproductive technology, since we should have all the setting of the reproductive axis and the metabolic tissues as well as the ovarian function under the best control of the insulinemic system, mainly also of the post-receptor signaling, such as of inositol. So the presence of myo-inositol together with carnitines and together with arginine and cysteine is for sure the best improvements of the function of the reproductive axis, also under the stimulation for the ovary.
Thank you. And then an anonymous participant asked Gian Maria, please show that, if you can repeat the hormones to be done in the evaluation of male infertility.
So the hormonal panel that is important to evaluate when you have a male infertility is the testosterone, is the FSH, is the LH, and the inhibin B. But if you want to make a better evaluation of the testosterone, you should even include the SHBG and even the albumin. Because if you want to calculate the Wertmuller formula to exactly understand the bioavailability of the testosterone, you should include the SHBG together with the albumin and not only the total testosterone.
Thank you. And then for Alessandro, is this integrative approach useful only in cases of insulin resistance and or overweight and obesity?
Well, whenever we have overweight or obesity, for sure we have a little bit hidden, but we have insulin resistance and at least a slight reduction of insulin sensitivity. So the good health is the balancing of insulin resistance, which is occurring in specific physiological conditions, with obviously the conditions induced by overweight that counteract, together with obesity, the insulin sensitivity with the improvement of insulin resistance. On my opinion, in our experience, is obviously important to keep everything under control. We should do this with a lifestyle of every day. So we should avoid too much carbohydrates, glucose, and keep everything under control in terms of have the right nutrients. That is meat, which contains myo-inositol, vitamin C, also a little bit of arginine, and vitamin D. But this is not easy. So probably we might use this as a normal addiction, maybe 2-3 times every week, 1 day, 2 days in a week at least, just to let the biology have the addition of those things that are not probably in the right amount kept with the food.
And Gian Maria, please, I wanted to have your advice, because you have mentioned that fantastic study done in Israel showing the reduction of 1.4% per year of the male fertility. And you are also speaking about lifestyle. Please, as you know, this starts certainly not only in adult time, this starts also in childhood and in adolescence. Then I would like, as you, as an expert on this topic, as wonderful urologist, please give to the mother and father who are following us your suggestion how to face this possible problem since the beginning.
Yeah, this is a really complicated question, because
yes, but
if I knew the answer, maybe I was winning the Nobel Prize. But anyhow, I have to be honest. What I understood in my experience is that it is true that your health is directly connected with your fertility status. So conducting a healthy life, not being obese, not having diabetes, controlling the hypertension can really help you in having a better fertility. Even the diet is really important. The correct diet helps you having a better fertility. Finally, unfortunately, the pollution and our lifestyle is not good. But how can I say? About this is difficult to deal.
Yes, but also I think the way of dressing, because in nature, God have decided that the testicle have to remain outside, while the ovary, they are inside to the abdomen. And the testes are outside because they have to be at lower than 34 degrees. Then do you believe that also we have to speak with the mother and also with the adolescents to try to dress, leaving the testicle in the proper location?
Yeah. Even the education is really important. Unfortunately, we live in a life, we are in a life where education is finishing, but at all regards, not only for how we dress, even in other points. So, and I believe that COVID gave us not an help in this. So really, the lifestyle, I think, is one of the most important things that we have to take care of.
Then we have a question for Alessandro. I think it's an anonymous who know very well you. Alessandro, what difference is there between the myo-inositol and the hero-inositol use in PCOS?
This is an incredible question that probably needs a couple of hours of discussion.
No, you don't have the time. You don't have the time. I give you 3 minutes.
We can shrink this to the important and relevant issues. Well, the presence of familial diabetes predisposes a reduced production inside the cells of the chiro. But this is not the only important element to drive the metabolic control inside the cell. We need to have also other issues, such as the effects of arginine, cysteine, carnitine, and also lipoic acid. So we might have a reduced production of the chiro, but if all the other issues or the other elements are able to modulate and to have an action on the control of the metabolic pathways, you might get the good results of having almost everything under control. The problem of the myo-chiro ratio, which is an important issue that we should state, is under debate, and we are really studying these issues. It is quite clear that the perfection cannot be reached in any case, and nature does everything in her own proper way. So the equilibrium of all the elements are not the same in the same patients. It changes through the age, if it is of a certain level during adolescence, during fertile life, and during menopause. So we are just now trying to test and to set everything according to the moment of the life where we might have in the problem of the metabolism, the greater issues for health and for reproduction.
Then I will give an answer to an anonymous who is asking if male infertility as this, no, can we depend, is Georgios Sarzetis, can we depend on multi-ingredients formula with no documentation, or multi-ingredient formulas presenting only the documentation of their ingredients? I think that we have to ask always the documentation of the ingredients, the quality of the ingredients have to be ensured. It's not only multi-ingredients in general who can be provided without any definition of what it is, how it's prepared, and what are the dosage. And then now I would like a final comment. We will start from Gian Maria. A final comment on importance of micronutrients, the importance of the new concept of the oxidation impact in male infertility, and your suggestion, and later on to the same question to Alessandro, not speaking about MOSI, but speaking about impact of insulin resistance and obesity in this world. Please, Gian Maria, your final comment for this fantastic webinar. We have still more than 160 participants.
So we had a peak of more than 200.
Yes, yes, but they're still now at the discussion. It's fantastic.
Yeah, yeah.
Please, go on.
So my final comment is by the end related to the previous question. So since I believe that the lifestyle is the most important part to keep our fertility in a correct way, and since it is difficult nowadays to keep a correct lifestyle because you are running everywhere, you don't have time to a correct diet, and for this reason micronutrients can help you to keep a better balance, a better situation in your metabolism. So by the end, I really believe that day by day their importance is really high.
Thank you. Alessandro.
Well, the problem and the issues of micronutrients is essential, since whatever we are able to eat, it should give us nutrients or micronutrients. I again say that we are not having food in the proper way. It's not really taken from Mother Earth and from nature in the proper way, is packed and conserved in terrible ways sometimes. So the fact that we might add what is not really properly contained in the food that we are keeping probably gives us a little bit more capability to defend ourselves from the excessive oxidation that our everyday life is still promoting and producing inside us. So physical activity is perfect container of the, stress in a limited amount is perfect, but we are not able to avoid everything. So the presence of micronutrients and the addition of integrations in a specific right amount is able to face and to help our biology to be able to survive to all what is happening around us, including a COVID-19 story.
I totally agree with both of you. I am also using micronutrients, not for my fertility, I'm approaching my 80s, but to try to maintain the full body and mind in the adequate function. Then I would like to thank all of you. I would like to thank Alpha Sigma for that beautiful webinar who give to the ISGE, the International Society of Gynecological Endocrinology, the capacity to approach the micronutrients important in human fertility, not only taking care of the woman, but also taking care of the man, because fertility depends from both. And then I would like to thank all of you, and I would like to invite all the participants to the upcoming webinar. I just to remind you the dates and the topics of the upcoming webinar. Next slide. The 1st of December, we will have obesity during the menopause, incidence and implication, with two fantastic speakers, Professor Antonio Cano and Dr. Augusta Maturana, and Fred Naftolin will be the chairperson of this session. And the 13th of January, we will have hormone-dependent and independent aging of the pelvic floor, external genitalia and skin. And the master will be Professor Tommaso Simoncini from Pisa and Professor Mark Brinkat from Malta, and I will have the honor to chair that session. Then, dear friends, dear colleagues, welcome again to our webinar, which are done waiting the time of our 20th World Congress of Gynecological Endocrinology in the magnificent scenario in presence in Florence from the 11th to 14th of May 2022. I wish to all of you health, prosperity, and be free from the COVID. Do vaccination, suggest vaccination, take care, wash your hands, use your mask, and enjoy the life, because we can also enjoy the life even with the mask, even washing the hands, and even making vaccination. Better living than to be out of vaccine. Thank to all of you for being with us. Thank Gian Maria. It was a fantastic talk from Foggia.
Thank you.
Thank Alessandro. Fantastic presentation from Modena. And thank to all of you to being with us.
Bye-bye.
ISG, welcome all of you.
Bye-bye.
Bye-bye. Arrivederci.
Ciao, ciao, ciao.